Hi, my name is Mark Klein. I'm one of the staff hematologist-oncologists at the Minneapolis VA in Minnesota. And we're here at AVAHO to present a poster on our project incorporating palliative care into routine head and neck cancer treatment. The reason we got interested in this particular project was a couple of years ago there was a survival benefit shown to incorporating palliative care along with treatment for metastatic lung cancer. And so then in 2012, the American Society of Clinical Oncology put out a provisional clinical opinion recommending the incorporation of routine palliative care along with usual care for people with metastatic cancer and also for people with cancer of high symptom burden. So the first thing we thought of at our site was head and neck cancer. So what we have done so far is worked with colleagues in palliative care to incorporate routine palliative care services for all patients getting concurrent chemoradiotherapy for head and neck cancer. The reason we have done that is have chosen that particular selection of the head and neck cancer patients is because they tend to have a lot of symptom burden. So with chemotherapy and radiation, they get bad problems with esophagitis, so they have a difficulty swallowing, require feeding tubes, and have a pretty tough time over the course of 6 weeks or so of chemotherapy and radiation. So what we've done is we've gone through and done a retrospective study to have a retrospective cohort to compare with, and are having palliative care visits with our patients at the baseline, and then 6, 12, 26, and 52 weeks after the start of therapy. And we, along with palliative care visitation, we will do particular questionnaires like quality of life questionnaires called the FACT, a spirituality questionnaire, a swallowing questionnaire, and then 2 mental health / depression and anxiety screening questionnaires. And so far we are in the midst, we've approached about 19 patients. 9 agreed to get palliative care. So one of the things that we're going to be looking at in the future is what are some of the barriers to incorporating palliative care, because we think it's a win-win situation, but a lot of patients are having a little bit difficulty wrapping their heads around what palliative care is. A lot of times they think it's just one more burden and don't quite clearly understand the benefits they might get. So we're hoping that our data will show that and they'll want to incorporate that, because this is kind of where the oncology has been going for a little bit now.